All right, you may know too well about nasty ear infections for us humans, but what about your dog? Joining us right now are Dr. Randy Thomas and Dr. Lisa Akasewicz, both veterinarians at the Southeast Veterinary Dermatology and Ear Clinic. Thank you both so much for joining us. We appreciate it. Got your name right.
You did.
Off to a fantastic start, Dr. Lisa. I like it. Tell us all about your center. You guys are full service for dogs, cats. Any problems you have, you guys can take care of them, right?
Yeah, we're a specialty practice, so we do referral only, and it's really specialized in dermatology. I'd say primarily allergies. Probably 3/4 of what we do is allergies in dogs and cats. But we see anything that involves the skin, the ears, or the claws.
Yeah, let's talk about these ear infections, because I was reading, you guys told me that ear infections are one of the most common reasons for veterinary visits in dogs. You guys deal with a lot of them.
Yeah, we do, and actually they're also, many times they're linked to underlying allergies. So if they're more common than just the yearly ear infection, or we usually go and trying to look for the underlying cause of the ear infection.
Yeah. Dr. Reddy, what are some of the signs that pet owners, especially dog owners, can see in their pets that they really need to get them into Southeast Veterinary?
Probably the most common sign of ear infections is redness or odor to the ears. A lot of times the dogs will be acting uncomfortable. They'll be rubbing either their head on the carpeting or on the furniture, and shaking their head a lot. That's probably the most common thing people see.
Because my dog does that all the time. She rends her head right on the carpet, but I don't think she has an ear infection. So how's it really possible to tell? Is there kind of an odor as well that you might want to check out?
Yes, odor, and then also the other thing I would say is pain.
Yeah.
Owners will notice that they might put their hand on the dog's head and the dog might yelp, or they can't look at the ear, and that sort of thing, and they'll know.
So how do you guys treat it?
It depends on what we find. We try to determine first, is it bacterial or a yeast infection? Sometimes it's both, and we'll go ahead and recommend some treatment for that. But in the big picture, what we want to do is kind of treat the ear infection like a symptom. So yes, treat that infection, but what's the reason the dog got it? And if we can diagnose that reason and manage it, then we have a better chance of preventing future infections.
Yeah, how many ear infections is too many, the sign of an underlying problem in a year, you'd say?
Well, what we usually deal with is the chronic reoccurring one. So they go to their veterinarian, they get treated, it starts to look better, and then even maybe better for a small period of time, but then relapse very quickly. And so in those circumstances, then we think, well, maybe this is a middle ear infection and not just an external ear infection, which means it's gone beyond the tympanic membrane or the eardrum.
But you guys are able to handle both of those, I'm sure.
Yeah, absolutely. And I'd say probably more than 4 ear infections per year. It'd certainly be reasonable to think about working them up further for an underlying cause.
Right. Well, tell us where you guys are located and your hours, your phone number, your website, so the people that might be experiencing this problem can get in there and get it taken care of.
We're in Mount Pleasant. We're in the Queensboro, or just outside the Queensboro Shopping Center. And we work by referral only. We work really well with the local veterinarians. So when they feel like this is a good case to send on to us, they'll make a referral, and we meet with the owners, and then we work very well with the veterinarian to manage the case together.
All that info on your screen right now. Pay them a visit if your dog is yelping or you notice anything that might be a little suspicious. Dr. Randy, Dr. Lisa, thank you guys so much for coming. We appreciate it.
Thank you. Appreciate it.
Coming up next on Low Country Live, we're roasting for a good time. We're going to tell you when, where, and most importantly, why. That's next. Stay with us.